Hello, my name is Raquel Palazzolo, Community Specialist for the Kirksville Yes program. Welcome to the LOQW podcast series, a space where we talk about who we are, where we've been, and what's happening now. Each week, we'll share a real conversation about disability services, advocacy, and the issues that impact our community every single day. You can find us on Facebook, Spotify, YouTube, and X, so be sure to follow along and soar with us. Joining us today is Amber Odell, IDD Advocate and Service Coordinator with Adair County SB40. Amber, welcome to the podcast.
Thank you. I'm really excited.
First of all, can you introduce yourself and explain about what a service coordinator does?
Yeah, definitely. So, as Raquel said, my name is Amber Odell, and I am with the Adair County SB40. My main focus is assisting families with anything that is a disability-related need. That could include advocacy, such as in the community, IEP supports, setting up services, linking to providers, funding assistance. There's times where we even help with like Medicaid, housing, benefits, really anything that a person with a disability needs. We're kind of here to help navigate basically the community, the resources, and just having an understanding of equal access to anything that they would need to be successful.
So we cover a lot of areas of support.
Quite a bit.
Okay. Well, my next question is, how involved are service coordinators in setting up services such as the self-directed personal assistant services and day habilitation?
Yeah, so we're actually pretty involved. I'll kind of do like an overview of how to set up a service such as that, since we would be the ones that would need to assist with the setting up with the funding, the documentation, and then also maintaining the services for the state compliance. So usually for a waivered service, a family would come to us with a need. We would see if they have an eligible disability diagnosis to qualify for the waivered funding. Location and demographics also plays a pretty big role because you'll have to have providers willing to travel to the area that you're at. Once we have established that need, we also work with them on goals. The goals can look like anywhere from community integration to daily living skills. I know day hab's also really good for like socialization skills. Once we have established those goals, then we try to set up provider meetings. That's not always required. I just usually recommend it because I want my families to have, a say in who they want to work with, kind of get a feel beforehand with if they're going to be a good match with this service provider or not. From then, we do an addendum. If they already have a waiver, it makes things a lot more simple to request. Now, if they don't have a waiver for the funding, then we would have to request it, and there's a few more steps involved with that. Once the service is approved, then the providers will start working with the family on everything we listed in the addendum and the goals. From then, we also do the annual reauthorization if they're going to continue that. We can also do addendums to change the goals if we feel like something needs to be changed. But then we're also responsible for reviewing the reports, seeing the services occur in real time, and then also following up with any concerns the family would have. So we're essentially the ones who monitor and set up everything. So we play a pretty vital role when it comes to the management of the services.
Do you ever run into situations where there aren't any service providers available for certain areas, especially in Northeast Missouri where we're so rural out here?
Yeah, we run into that quite a bit. So for example, I like to work in Schuyler and Scotland counties. They're amazing counties, amazing people. The resources that they do have are very few, but they're very impactful for what they do. So we're always looking for more people to come out there. Now, when I first started, the biggest difficulty we had was that not all providers can provide transportation to go 30 to 55 minutes away. However, I have been able to work with some agencies a bit newer to the area to where they're willing to go out there if they have multiple people. And so due to that, it is going to take some time to probably set up the funding. There might be some wait list in regards to some of the requests, but as far as available services for the smaller counties, it is very difficult to get in place.
And as far as services, I know that self-directed services are used by quite a few people in our rural area. And then, of course, some day habilitation as well. From your experience, why are these services important for individuals?
I think one of the biggest reasons why these services are so vital to our individuals is that it's the services that allow for probably the most independence. And it really follows the home and community-based rules. So for self-directed in particular, that's one of the very few services that is available to our families in these smaller counties or harder to reach areas. It allows families to be caregivers. It allows the person to have autonomy and to be able to pick who they want to be their personal assistant. And it's oftentimes either a family member, a community member, or even a friend. It's also a very low-cut service because it doesn't, unfortunately, the PAs don't get health insurance included. It's not accounting for like the taxes, the transportation. And so when you see the budget overall, it's very cost effective compared to the other more expensive services. And in addition to day hab, it provides a community setting for individuals. And it also allows them to go out in groups or in teams to places in the community. They get to make connections. They get to go to coffee shops. They can go to grocery stores. They can go to community events. And so not only do they have that community setting established, but then they also get to educate the community about themselves and disability rights and accommodations. And so, and inside the day hab setting, you also get to work on other skills, whether that's probably employment or, cooking, budgeting, whatever goal they have and the provider is willing to work on. I mean, it's a very vital service for a lot of people.
Have you seen significant positive changes when individuals receive consistent services like these?
I do. I have a couple of families that are in those smaller outer reach counties. And with this service, I know that they feel more involved. They feel like they have more of a say, which then in turn leads to more independence, more education for the community. It also allows them to have services in the safety and the comfort of their own home. I know individuals who feel isolated in these other counties, if they're able to go to places like the day hab services, they're able to make friends. They're able to work on their skills. They're able to just have these connections that they've never had before. And it allows for a judgment-free setting, essentially. And so in turn, I've seen so many positive outlooks for all the individuals that we work with that now we have other people who are wanting these services as well. Because now they have hope, they have things to look forward to, and they're also advocating for their own wants and needs because they see the impact that the services are having within their communities.
So because of these positive outcomes, among those, do you see the services helping prevent higher levels of care that historically are sometimes needed, such as hospitalization or institutional placement?
Yeah, so I do see that these services are probably the more less costly compared to what I've seen before. So, for example, when you look at the self-directed PA service, you just get the service and the goals that the PA is going to do. It doesn't account for, like the taxes, the trainings, the transportation. It doesn't account for, like the health insurance. And so when you see the budget, which is, I think, roughly, if you ask for the 40 hours a week, is about $62,000 to $65,000 annually. I would have to double check. Compared to other costly services that can cost hundreds and thousands of dollars, depending on that person's needs. So, for example, if you look at a budget for somebody with an ISL, which is that independent, living support home where you either have staff, 24/7 combined with other remote monitoring services, it's great because it is individualized to that person's needs. However, when you're looking at those budgets can range anywhere probably between $200,000 to $300,000. And so the benefit of the self-directed is that the person gets to hire whoever they would want, and they would still have supports to manage the service, but it is so cost effective and it allows for so much greater independence in the least restrictive environment, which is also super important because with the self-directed in particular, the concern I would have too is that, if they didn't have that service in place, then you can also see an increase of, emergency situations, hospitalizations, a greater use of, Medicaid dollars going to other areas of needs to make up for that. And day hab in itself is also very cost effective because it also allows for those skills and that community integration, but the day hab costs for those services are still significantly less compared to the other ones like individual skill development, community networking, which is one you can just request, outside of that too.
So you see the self-directed being a lower cost option for somebody, whereas if they didn't have self-directed, you're saying you could see them needing an ISL potentially or something just more expensive.
Yeah, because you can't just request like an ISL off the bat because that's like what's called the comprehensive waiver, which is one that you technically need to kind of work up to prove that you need something like that. But it is more cost effective compared to the other services. Mm-hmm. The other thing that I would be worried that people would run into, so say if they're not able to use the self-directed or day hab services anymore, then what is the gap going to be for services? Are they going to still have people helping with the daily living goals, with the transportation, with like cooking, anything that they had a goal for? Who is going to start helping with that? But then you're also going to have to consider the location. Is there other service providers to make up for that gap? Or are they going to have to consider moving? Or are they going to be at risk for an increase in medical needs, hospitalizations, or even homelessness? Because if that was the supports that the family was using, what's going to happen to their overall situation? And more than likely, it's going to cause an increase in the use of government benefits like HUD, food stamps, more use of more costly services. And then we're going to still see an increase of risk just going from there.
I see. And I think you kind of touched because I wanted to ask about if services might be reduced, what with the budget changes and things like that, and how that would affect individuals long term. But I think you kind of highlighted that we could see increased homelessness. We could see a person trying to access services that just aren't available in their area if they were to lose self-directed services.
And we're also looking at like longer wait times too, because a lot of these places have wait lists, or, it takes them a month or a couple of months to pen for the applications. And that's usually if everything goes right. Mm-hmm. And so thinking of the bigger picture too, there could be, budget cuts and it helps in the short term, but we need to consider the long-term costs that are going to also be tied into this. And so with the increased use of the government benefits, the increased use of more costly services, as well as longer wait lists, probably even confusion with what resources are going to be available, I can see this being more challenging down the road than what people are expecting.
I see. Can you touch a little bit more on why are community-based services more cost effective than institutional care?
I would say that probably the biggest reason is the different types of service rates when it comes to looking at the budgets. I would say that with these programs, they probably have a lower rate compared to the other services. A lot of them can cover pretty similar needs, but when you look at the service rates compared to, self-directed and how little it offers outside of the actual paycheck compared to everything like, an ISL or individual skill development, community networking has to cover, there's quite a bit of a difference in who can be paid what.
I see. Well, so let me ask you this. We have policymakers in Missouri right now deliberating over the budget, especially this 2027 fiscal year budget. We see a lot of proposed changes. What would you, as a service coordinator, want policymakers to understand about the types of services that they are weighing, such as the self-directed services and the day hab? What would you want them to most understand about them?
I would probably want them to mostly understand that in the short term, this does look like it's potentially going to save the state, money. However, in the long term, I believe it is going to be more costly than what is expected because of all these other outside factors. One of the biggest difficulties that I see as an advocate is that there's a lack of education when it comes to the disability community, especially because our community is one of the largest minorities that people often forget about. It affects any age, affects any group, any demographics, any race, and it can happen to anybody at any time. And so with that, you're going to want to have education on disabilities, but also the availability of resources. The biggest thing that our people often ask for is independence and the ability to be an active community member. And it makes all the world of a difference. They want to be able to stay in their homes. They want to be able to, cook a meal within their kitchen. They want to be able to go shopping at the local grocery stores. They want to go and make friendships out in the community just like anybody else would. And so being able to have those services in areas that already really don't have anything, these are life-changing services for people. And especially if you have younger kids, because I have a lot of school-age kids on my caseload. So I do a lot of what's called transitional planning from 14 to 18, and that's preparing them for adulthood. One of the things that we look at is, okay, what can we do right now to get you ready to where you want to be when you're 18? And so self-directed and day hab are usually the ones that I often refer to, because then they get to start working early on to start practicing budgeting, to start practicing going to the grocery store. Whatever a goal that they may have, we can work on it, even practicing maintaining a schedule, medical appointments, anything that they want to do to feel as if they're prepared. We try to early on. And without these services, we're also going to see a skill gap too, because there's not that early intervention. So for example, I even had somebody who just recently started, and it wasn't until we had a meeting with the school that they asked what changed, what was different. This person is initiating so much more. They're wanting to be independent. We're starting to see them needing less services now. And it was because they had self-directed PA. And within a month of having a PA and working on a few extra hours every week on the goals that they've had has already made a life-changing difference for her to have. So these services are very crucial to our individuals and our families to be successful and to allow independence in the least restrictive manner.
Couldn't agree more. Thank you, Amber, so much for your time. It has been a pleasure talking with you today. To our listeners, thank you for tuning in. To share your input, you can contact your local Missouri legislators and senators by visiting mo.gov to find out who represents you and their contact information. Reaching out even briefly helps make your voice heard. Thank you for listening.